The first half of our session today features Genelle Lamont. Genelle is an MPH and PhD candidate working with the Minnesota Department of Health Oral Health Program. Better? Closer? Sorry. Her presentation will review the many ways the Minnesota Oral Health Statistics System, or MNOHSS, is an excellent online source for state and county oral health data on the Minnesota Public Health Data Access Portal. Once you learn about this invaluable tool, you are guaranteed to use it again and again. And the second half of our session features Bilquis Jiwani, an epidemiologist senior with the Minnesota Department of Health Oral Health Program, Clare Larkin, a prevention coordinator and dental hygienist, and Mary Jo Thoele, the dental director of the Oral Health Program. And they will discuss the Smiles at School program and how data is instrumental to the shared vision of a coordinated system of school-based linked dental sealant programs in Minnesota. So join me in welcoming the Minnesota Department of Health group.
Welcome, everyone. Thanks for having me here today. My name is Genelle, and I'm actually quite surprised at the turnout. Thank you for coming. You guys are some die-hard fans, huh? So who among you here use oral health data on a daily basis or just once in a while? Okay, a good number of people. How many of you have heard of the Minnesota Oral Health Statistics System, or MNOHSS? Couple? That's good. That's good. So that's what I'm here to talk about today is our really exciting, cool online oral health data portal. I'm also going to talk about some of the data that we currently have on the portal, what we expect to have coming up pretty soon, as well as some ways that you could use the data. So prior to our portal, people that have used oral health data probably understand the frustration with trying to get this for the work that we do. They're located throughout various federal and state agencies and elsewhere. And even within state or federal agencies, they might be housed in different units or divisions. Even within the Minnesota Department of Health, we probably have 5 different offices that collect this data. So the nice thing about MNOHSS is we've gathered all of that and plopped it into one area. So essentially the idea behind MNOHSS is it's a one-stop source for oral health data, so you don't have to go fishing, which is of course a Minnesota thing. So there's this really cool thing out there that's done by the Centers for Disease Control, and it's called the Environmental Public Health Data Tracking Network. So it's this huge infrastructure project that they had going on a couple years back. I believe there's probably 26 states that are involved. Here's a map with that. And so the idea about that was just to collect environmental health indicators. Minnesota happens to be one of the states that participates in that program, so we've really benefited from this additional infrastructure. So the different states are allowed to have what are called add-on topics, and so through our generous funding from Delta Dental Minnesota Foundation, we've been able to add oral health on this existing infrastructure project. It really is a collaborative project, and basically we work with the Minnesota Tracking Program, which is a Governor Award-winning organization within MDH, and we also work with our IT services to get that program into our online data portal. And that's the Environmental Public Health Tracking Network at MDH is called the Minnesota Public Health Data Access Portal, or MnData. Oh, and I was going to say there's about 3 state-based oral health programs that do have their data online, but Minnesota is basically the only one that's on this existing infrastructure project. So it's really exciting in that sense. Also, we've done a number of national conferences, and we heard from the other state-based oral health programs that Minnesota is really looked at as the gold standard. So here's a list of all the existing oral health data on the portal. Some of those you might be familiar with already. And then we also have a number of indicators or measures that we monitor, or we hope to monitor through time. And that's broken down into oral health status, such as sealants and tooth loss. Dental and oral health service use, both for the general Minnesota population with adults and children, as well as the Medicaid populations. Dental workforce and access to care, so the dental health professional shortage areas or dental HIPSAs that you might be familiar with. And also some very interesting population characteristics such as household income, children living in poverty, people without dental insurance, as well as free reduced price lunch eligibility, which is often used as a measure for childhood poverty. So how are some ways that you could use the data? Well, we can use it to monitor changes through time. We can use it to compare indicators by the US, Minnesota, or county for the indicators in which that's available. We can use that to prioritize and make informed decisions regarding programs and dental public health activities. You could also use it to develop a community needs assessment, such as for your county to know what type of data or what to better inform from different data sources what's going on in your county. Also to demonstrate need or add relevant background information and grant proposals, and to educate stakeholders, whether you put together your own presentations or your reports. You can use MNOHSS to mine the data to get the type of information that you need. So usually what I do, if I don't remember this long URL, which is provided right here, is I'll just go to Google and I'll type in min data, so MNDATA, and it usually comes up the first hit on a Google search. So here's the main min data portal, and to get to oral health, you want to either click on the top where it says choose topics, or you can go on this other drop-down window and navigate to oral health. So then you'll come across our page, which is called the landing page or introductory page, and it just provides some brief information for people who might be unfamiliar with oral health, basic messaging that we want people to know. And the other cool thing is that there's links to a glossary. So, for example, tooth decay, gum disease, periodontitis, things that people might not be familiar with. You can hover over, click, and a screen will pop up, and it'll give a really great plain language definition for each of these. So the first tab in here says facts and figures. It has since been changed to view charts, which we felt like that was a more plain language term. Oh, here it is right here. And if you click on that, it'll provide you with all the different types of data indicators or measures that might be of interest. So here's an example of some charts for the dental HIPSAs or health professional shortage areas. So here's a pie graph basically showing the different dental HIPSA designations by county as a whole for the state of Minnesota. And then next to that, because these aren't considered accessible or 508 compliant, so the state of Minnesota and federal agencies are required to follow accessibility guidelines. So that's for people who have color blindness issues or people that use screen readers. And so all of our colors that we've put into the charts are been approved for color blindness, but then there's an accompanying table for each of the charts, and that's for people that use screen readers, but it also might be something interesting for other people to look at. Also on some of the pages, there's what's called static maps, so just basically a PDF that you could download. So this is a static map for the dental HIPSAs in Minnesota. As I mentioned before, we put great effort into putting plain language and implementing health literacy into our data portal, because we realize it's not just scientists and data savvy people that might be interested in looking at our portal, although everybody really appreciates things in plain language. And with health literacy. So this is an example of one of our facts and figures pages or view charts pages for our basic screening survey that our oral health program delivered. And this is a health literacy example of the numbers. So instead of having, say, like a bar graph, which may or may not be readable or something understandable for people, you can put together what's called iconographs or icon arrays. So we have these little people to basically describe the prevalence of, say, caries experience or tooth decay in Minnesota. And the third tab is about the data. So I really do, like when you guys are going through the portal, I really do encourage people to read the about the data because it basically goes in and describes all the nitty-gritty and details, and that just aids in your interpretation in the data. So here's an example about the data for the dental health professional shortage areas. And then explore the data. This is something that a lot of people, I think, will find very useful. It has had higher hits on our portal so far. So for some of the data sets, we do have queries available. So that way you can filter the data, get exactly what you need. You can also download it as a CSV file or into a spreadsheet to use. So here's an example. So for this one, we have dental claims via the CMS 416 report, as well as general dental health service use. And then we also have the school free reduced price lunch. Like I mentioned before, this is something really useful when you're trying to decide perhaps if you want to do oral or dental health services in the schools. You can really use that as a tool to hone in which are the schools that are going to be the highest risk. So for ones that have really high school free reduced price lunch eligibility, that's assumed then that that's a school that has higher poverty level and thus higher need. So if you were to select that one, then you can pick which indicator you'd be interested in. So total eligible free reduced price lunch. And then you can select it by state, county, school district, and recently also by school. You can get that information. And you can also select which year. And this is an example of what it would look like. So one of the cool things is that for each of these column headers, you can sort them by clicking the top where you can see the double arrows. So you can click on it and it'll sort it ascending or descending order. And then also if you click on the name of it, a definition will come up. Oh, and then like I mentioned before, if you scroll down even further, then you can download based on that filter, or if you want the complete data set, you can download that as well. So one cool enhancement too that we've been able to implement on the portal has been mobile responsive technology. So normally if you're going to use like a tablet or your smartphone, you'd have to scroll back and forth and it can kind of be irritating. So with this new technology, and I would show it if it was on a full demonstration, but you can see with this screen what our landing page looks like when shrunk to a tablet or a smartphone size. The other cool feature that we have is not just the static maps, but an interactive map. So you can see more detail. So this is an example of one that we just put together for the free reduced price lunch data. So you're able to look at it by county level, school district. If you were to go into the search button, you could type in your zip code, your county, your city, and it would zoom into the area and let you play around and look at that data more. So here's an example if I click in at Hennepin County of what that would look like. So you'll notice like a lot of circles with numbers. Those are how many schools are located in those areas. So if you zoom in further, you'll see the purple dots, and those are individual schools. And then you can click on that, and you'll come up with this nice table box that'll tell you what grade level, how many students are enrolled, what's the total eligible free reduced price lunch rates, and what the poverty level would be considered. So in this map, we have it at a 4 category. So if you were going to prioritize schools, I would look at that bottom and look to see where it would say high or mid-high schools. For this one, let's see if I can. So here you can see maybe tools on the upper right-hand side. So if you were to click on that, then you could get this table and look at the data that we have put into this system. And you can look at the schools, the county, the school district, but you could also find that in the query if you wanted to. Oh, here's where it shows it. And then also on the bottom, you can download PDFs of the specific map that you want. This one's for the downloading the data set, and so here's how it comes up as a spreadsheet, and then that way you can, sort, look at the data more, generate reports if you want. So I just want to mention what's not up there yet, but currently in the pipeline is we're going to have a data refresh. So all the data that's already on the portal will have new updated data. Also, our 2015 basic screening survey, which was just completed recently, will be up there. Dental insurance, information from the National Survey on Children's Health, mainly condition of teeth, ever breastfed, and oral health problems. And the coolest feature is going to be the oral health data summary report. So you'll be able to type in your specific county, and you can look and say, okay, I just want to look at these measures or indicators, and I'll go bloop, 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 and you'll get a really nice layout tables that will be specific for your county, and if you wish, state information as well. So if you want more updates on the portal, just simply go to our main oral health program website and click on the subscribe button, and that'll bring you to our GovDelivery subscribe list. So again, I want to thank our partners, Delta Dental Minnesota Foundation, for making this possible, as well as our partners who helped develop the portal and added data to the portal as well. So here's my contact information if you want to contact me or if you have any more specific questions on oral health data. Thanks.
Thank you very much, everyone, to be here, and we'll continue the journey which Genelle has started with the data and information. I'm here to talk about collaboration in action statewide data collection reporting system. Today, we all are gathered here for a reason. The reason is we all want to make a change in the lives of people in Minnesota. We all want to collaborate and work together. That's the reason we are here. And we'll continue to do the same. And today's even conference name we have is collaboration, to work together, collaboration. I think, what's the name of that? I think collaboration, see, I forgot. Working together to meet Minnesota's oral health needs. So now we all are working very hard and we'll continue to work hard. How are we going to know that really we made the difference? What would tell us that really we made the difference? Data. Move the needle. And how would we know that we moved the needle? Our information, the data we collect, that is the one which is going to tell us that yes, we made the difference. Because data speaks. We say, where is the evidence? When we go and we say, oh, we made the difference in the lives of people around, they say, oh, show me the numbers. Show me the evidence. So data is very, very essential if we really want to show people that we made the difference. So today, my objectives are listed here. This is what I'll be talking about. So basically what I'm trying to do here is I'm trying to establish a case for developing and maintaining a statewide data collection system. what Genelle was talking about. And I think there seems like a buy-in there. People are interested. That's why at 4 o'clock, 3:30, they started, and 4 o'clock, they are still sitting, want to know more about it. Otherwise, probably on Friday evening, they would have left this room, okay? So that's what I'm trying to establish my case further, that data is important. Then we'll try to identify through you what are the barriers in collecting information, and especially related to school-based sealant program. How many people work with school-based sealant program in this room? They are present here. How many of you are? Okay, so there are 2 people. That's good. We'll see. And then of course, I will try to seek your input, and we'll try to capture some of your thoughts here that how we can create a collaborative system, okay? And at the end, I'll try to describe some of the stuff we are doing in terms of working on the data, sealant-related data. I have come up with a story. I was thinking that I'm at the very end tail of the day, so I have to come up with a story. So I have come up with a story. I have to read this story from my paper. Not long time ago, along the Minnesota River near Fort Snelling Parkway, a beaver named BB was cutting the trees down to build a dam. He saw a beautiful tall tree and spoke to himself, "This is going to be a great tree to cut, but it will be a daunting task." Anyhow, in Minnesota, the day was beautiful with bright sun shining down upon him to uplift his spirit. Doesn't BB sound strange that he likes daylight? BB eagerly engaged in his task, whereas the tree being cut was praying and hoping that it gets some help and is being saved. After a day's worth of work, BB finally was happy that now the tree was finally ready to fall in the river. But for BB's surprise, instead of splashing in the river, the tree landed on another tree. Alas, all the hard work of the day was good for nothing. On the other hand, the tree was happy that he was saved by other tree, whose roots this tree, the one being cut, has always held tight not to let the tree floated away by the flow of the river. Doesn't this story sound familiar to us? Sometimes unforeseen comes as challenge to fail us, and we see our partners or collaborators stand by us. Why do they do that? That's what collaboration means. That whenever we are in trouble, that's where the help comes. And that's the reason we all are here, because we feel like that if another individual, another program is working, I'm there to support. So that's why we are here. And that's what support we are looking for the system to be developed. So some of you may have heard of Smiles at School. Have you heard of Smiles at School Collaborative? Okay, 1, 2 people. This is a collaborative which, with the support from Delta Dental of Minnesota Foundation, Department of Health started to work with school-based sealant programs. And that initiative has worked quite well, and a good number of schools has been served by our grantees. And that is one of I would say one of the programs which we can learn a lot from, and that's the program on the basis of which we want to develop a system, because we have learned very good lessons. And Clare would, a little bit, if you can add on to about the program, I would really appreciate it, because she is a program coordinator.
Thank you. Clare Larkin, Minnesota Department of Health Oral Health Program. So the Smiles at School, which community dental care is very well represented here. Thank you for being here today. You're familiar with the public-private collaboration, and Bilquis had mentioned that Delta Dental of Minnesota Foundation was in that collaboration with Minnesota Department of Health Oral Health Program. So what we were tasked with is our award from Delta Dental of Minnesota Foundation was to a service agreement was created to provide technical assistance to the Smiles at School grantees. And those Smiles at School grantees consisted of 6 school-based sealant programs and 1 school-linked school programs. And I feel like I should call out the names of those groups because we worked very closely with them. Community Dental Care that I mentioned is here. Northern Dental Access Center, which was the first one of the breakouts this morning. Children's Dental Services, United Family Medicine, Just Kids Dental, Open Door Community Health Center, and Lake Superior Community Health Center. So we spent from 2013 to 2015 doing technical assistance with those wonderful groups of people, and the technical assistance that we did included such things as infection control for mobile and portable programs, which many of you are probably familiar with the OSAP, infection control for mobile portable checklist and all of the wonderful resources. SEALS data, which Bilquis will be talking with you about how to improve return of consent forms, and there was discussion this morning about things such as how do you get the parent there? Well, in school the parent isn't there, so how do you increase the consent for that? School-based care. Health literacy, Genelle did a wonderful webinar for our grantees on health literacy, and also, as Genelle showed you, the school-based, the free and reduced price lunch maps, which is technical assistance that we worked with the student, or with the grantees, because they were to be serving high-risk schools. So we were offered another funding opportunity from Delta Dental of Minnesota Foundation to continue that technical assistance, and we're really looking forward to the next about the next 20 months of time to be continuing working with school-based programs and to try to figure out how we can become this collaborative, coordinated system of oral data. So I'll turn it back to Bilquis. Thank you.
Thank you. Next slide. So now our grantees collected tons of information when they were in the field, and they are continuing to do so. So what we did is that we analyzed the data, and we have shared with our funder. Delta Dental has already received the report, and we will be sharing the same reports with individual grantees also. So this is a map of the schools being served by the grantees. Can you see it does it look clear? It doesn't look very clear, because I want to generate some discussion on that. The triangle is the schools reached, which means that the schools being served by our grantees. The little black squares are the high-risk schools, because the grant was supposed to, according to the grant, our grantees were supposed to be serving high-risk schools. High-risk schools means where 50% or more of the students are eligible for free and reduced lunch programs. So when you look at this map, what does this map show us?
There's need.
There is need. Is it evenly distributed throughout Minnesota? Do we see that? Do you see that this whole region is being served or not being served? Not being served. How about that part on the top? The northern part? It's better? So these are the schools. We are not talking about children or anything. We are just talking about the schools in the areas, and then we are trying to map them with the schools being served. What does it tell us? We need to go southwest. Okay. What else? Do we need to go there? Okay. So we are looking at the reach, that are we reaching the high risk? We are not reaching the high risk. There are a couple of spots. Do you think that why are we not reaching? We'll get to that discussion. Just keep thinking, what else? Is this that we are not working in those regions? Or is this some other reason? Or maybe the map is wrong. I just put the wrong numbers. What does it tell us as a provider? What does this tell me if I'm a provider and I'm really worrying about or thinking about Minnesota children? What does it tell me? Am I doing what am I supposed to do? Can I do better? We need more providers. Do we need more providers, or the providers are there, but unfortunately they can't reach? This could be the reason too? Or no? Or maybe I'm wrong. What else? I need us to think. The reason I throw this map here is that we have to think. Anything else? Very good. Maybe there are programs which we don't know about. What else? Have we exhausted all the responses? There are programs there, they are not reporting. Okay? That's a very good answer too. Okay, let's move on. Next. Can you turn on the lights, please? Yes, please. So this one, we are familiar with this particular report, our beloved Pew report. How many people are aware, have seen this report? Like a Pew, how many people know about Pew reports? Not very many. That's very surprising. Okay, so this is Pew report of 2014, and Minnesota got B-. In the previous 2013, Minnesota got B. A year before, fortunately, we got A. So for last 2 consecutive years, we are getting either B or B-. I don't want to, see, I'm not advocating Pew report, neither I'm denying the Pew report, because I don't want to go into the methodology, the way they come up with B's and A's. But what I'm trying to say here is that as soon as Minnesota got B, everybody started talking about. People started asking, what are we doing? Why did we get B? Aren't we doing very well? How can we get B? Because for B-, we Minnesotans, we don't like these kind of grades. We feel like that we are the best. So then we ask ourselves, are we not doing good? We are doing good. But maybe there are other reasons that we are getting B. Mary Jo, would you like to just talk about a little bit, because it seems like people are not aware about the Pew report, so that I'm trying to build my case, okay? That's the reason I'm showing you these things.
This is actually the fourth of a series of reports done by Pew. One of the things that's really important to remember about the Pew reports is that the A was on an entirely different topic, not on school-based sealants. So it looks like we've gone from an A to a B, or an A to a C to a B, then to a B-, but it's actually only the last 2 reports that have included information on sealants. The 2012 report was called Falling Short, and the 2014 report was called State Stalled on Dental Sealants. And the 2012 report, we got a B, and it's based on 4 indicators, and you can see you can see in the top line the first indicator, which is the number of high-risk schools served by school-based sealant programs. And you can see that in 2012 we fell within the 25 to 49% range, the same range in 2014, and the goal of 75% or more has not changed either. So why did we get a B-? You know, and on all of the 4 indicators, there was no change. But in this report, they added another measure. So that it's, you know, something you keep in mind when we're talking about the Pew reports is that there's actually additional measure here. The minus is for something that Senator Berglund talked about this morning, which was the importance of helping of DHS helping and facilitating FQHC services outside the clinic. And that's what what the minus is for. The other 4 indicators have not changed for us. So we still, in a way, got to be. But I just wanted to mention that this report also, in 2012, we were just slightly more than 20, from what we knew, slightly more than 25% of the schools served. In 2014, we were at like 48.5% or something. So we actually, this does not show that we actually have increased the number of programs that we know about. The other thing I just wanted to mention, that when that Pew called us and asked us for the information on the schools that we served, and we asked them, how do other states report? And they said, just give us your best guess. You know, tell us about the programs that you know about. Take a look at all 4 reports. That would be a good student project, is to compare the measures from the 4 different reports and how the grades go from an A to a C to a B to a B minus. Very interesting.
And usually these kind of reports, media also picks and starts asking us questions that, you know, what we are doing. So that becomes little situation for us that, you know what, we really have to work, that something has gone wrong, okay? So exactly. So now the questions which we have to think, where does Pew get the numbers for their report? What's the guess? From where? No, these are the population-based data. They are not Medicaid population.
And I just told you where they got their numbers. They called us and asked us what percent of high-risk schools do CEWS programs serve.
Do we have a data system in Minnesota that report data to Pew and other federal agencies? Do we have one system? Does one entity get all the information for school-based sealant programs? Are we aware of it? No, we don't. If so, and we say that and earlier Mary Jo said that there is one basically, they call us. They call state agencies. Like they ask Minnesota Department of Health or DHS that, hey guys, we want to know what's going on in Minnesota in terms of school-based sealant program, because they think that we should have all the data because we are the state agency. So in reality, we don't have. So if we don't have the information, whatever the information we have, we'll keep on giving that information, and probably we'll continue to see these kind of grades. Okay? So that's what we wanted to say. Now, why do you think that I'm coming up with school-based sealant program? Why am I giving this example when Genelle was talking about all the data system? We just talked about we don't have a consolidated system. We don't have one place to report that data. And school-based sealant programs, we know that sealants are one of the most effective evidence-based strategy for combating caries in children. Fluoridation is another one, definitely. So one of the most important ones. And all the federal agencies, CDC, HRSA, they ask for school-based sealant programs, that what is the sealant rate in your state? Because that's a population-based. CMS reports, which come from DHS, they are for not general population, they are for a specific population, Medicaid population. So there is a difference between those two. So whenever you see the numbers from coming out of DHS, always remember, those numbers are only for the population which is a Medicaid population. That's not the reflection of the general population. Whereas our grantees out there, whoever works for school-based sealant program, they work for everybody. Although their target is underserved population, uninsured populations, and Medicaid populations. So when they report those numbers, which we report to Pew, are everybody. It's not the Medicaid population. So that's a very important distinction, and a lot of people I have seen, a lot of data people and oral health program, they always report CMS numbers and they say, what's going on? But remember, that's not a general population, that is a CMS population, which is a Medicaid population. So don't make this mistake. Those who are attending this session today, please, if you have ever done that, okay? So that's one of the reasons. And we talked about it, national systems are looking for it. Go ahead. So now the question is, are we all interested to develop this kind of a system? Would we like to see that kind of a system or not? Because somebody has to take the lead. But taking the lead is not enough unless somebody is ready to give and share their information. If people are not ready to share the information, if I'm ready, I'm like, oh yeah, I'll do the data analysis, I'll do everything for you, and Katie has the information, or maybe Jessica has the information, she's like, forget about it, I'm not giving you. Okay, so the important thing is that, and when we talk about collaboration, if we are sitting here for last 6, 8, 7 hours, just talking about collaboration, it's not going to work unless practically we take a step and make that evaluation in practically coming in action. So that's what I'm trying to develop a case, that if we really are interested, that we really want something, a system comes to be existent, then we need to work together to make that happen. Okay? Another picture. This is, the photographs which I'm showing you, courtesy is Clare Larkin. She has getting these beautiful pictures. She brings it, and all of a sudden I see it, and I'm like, oh, we can use it in one of our presentations. So that's the way we are doing it. We didn't go and intentionally took a picture. We took a picture, and then we are using them. Okay, so this was this is. Are you familiar with this? Okay, Claire, why don't you talk about these gin pole boathouses? And then I'll relate it to what I'm talking about.
I live in Red Wing, Minnesota on the Mississippi River, and Red Wing is noted to be one of the few, if any, remaining called gin pole boathouses. And a gin pole, I had to look up because we don't have a boat, but a gin pole is an apparatus that has poles that hoist things up. And so these boathouses are actually built on, you can see poles on each end of the boathouse. And I don't want to steal Bilquis's thunder about why we thought this was related.
Okay, what is in it for me? Because all this I'm talking about, probably for me there is something, because I'm coming from some people will think, oh yeah, you are coming from this Minnesota Department of Health, so you are worried about more the data, the consolidation and all of it. So now the question is, everybody will be asking, what is in it for me? Bilquis, for you, I can see that because you are coming from a unique place, so that's why I can see that. But for me, as for a program who is running a school-based sealant program, what is in it for me? The example of gin pole, we gave it because what happens when the tide comes, everybody goes up. It's not that one goes up and the other one goes down, everybody comes up. So what benefit we all are going to get with that is, once, if we all agree upon collecting we all are collecting, and start reporting the system, what will happen is that our vision is that we can create a dashboard. Okay? And this is an example of a dashboard which Ohio is doing right now. And they're very successful in doing that. And it's not impossible to do it in Minnesota either. If we all agree upon that this information is very important that we all share, and we are able to report not only to other federal agencies and other agencies, but when we apply for funding, like I as a program, if I'm applying for funding, and if I can present the numbers, not only what I did, but what's going on in the rest of the Minnesota, don't you think that it is going to strengthen my grant application? So that's also another benefit. And once these kind of dashboards, and these dashboard, through these dashboard, individuals' reports can be generated. which the smaller programs who do not have the data analysis skills or they don't have evaluators or epidemiologists, they can use that information to use it in their programs. So that's what the MDH vision is. And eventually, of course, the beautiful system which Genelle showed you is our dream, and I think everybody's dream. It's not our program. Of course, we are very thankful for Delta Dental of Minnesota Foundation that they are supporting us to develop this system, but this system is everybody's system. So that our vision is that the school-based sealant data and information also becomes part of the bigger MNOHSS. So that's what I'm trying to sell. And right now, we have got the data which our grantees gave us, and we are preparing those reports, and hopefully we'll be sharing that with our grantees, and I'm sure that they will see the benefit of those reports, and we can continue doing that if you all think that it's important task and we should do it together. That's what I wanted to present, and this is what I wanted to sell myself for my case, basically. So I don't know how successful I am in building my case. Any questions for Genelle and I? We'll be there. Yes. How can I forget this slide? That's the biggest sin I could have done. I love this quote. I want you to read it and reflect. Thank you very much.